All right, good morning. Welcome, everyone, and thank you for tuning in tonight or this morning, to Health Talk. I'm Dr. Victor Politi. I'm the president and CEO of Nassau University Medical Center, New Health, that big building on Hempstead Turnpike in East Meadow. And today we'll be talking to Dr. Roger Simpson, who is our chairman and president of Long Island Plastic Surgical Group, one of the premier plastic surgical groups here in Long Island. And, when you hear someone's a plastic surgeon, you think of cosmetics, you think of people enhancing different areas of their bodies. But plastic surgery, as I've learned, is so much more than just cosmetics. Plastic surgery involves many aspects of what we see in the hospital every day, in the emergency department, in traumas, in facial wounds, in burns, in hand injuries. And the plastic surgeons are such skilled surgeons that they're able to work in these really, on these really sensitive areas of the body, like your face, and do such great work to minimize, the damage and the scarring that occurs. That they really have a huge place in medicine, and one wouldn't think that by just hearing the term plastic surgery, because it's been somewhat, overemphasized in the world of cosmetics and elective cosmetics, should I say, not even medically necessary cosmetics. And so we have all of these services at the Nassau University Medical Service Center. It really is an amazing hospital as to the services that we can have to provide to the community, whether it's cardiology, pulmonary, emergency department, hyperbarics, GYN, gastroenterology. And on these Saturday shows, I'm trying to bring specialists from the hospital to the radio, so that we could talk to the listeners and basically give you a little insight, not only as to what's happening in Nassau University Medical Center, but what these different surgical and medical specialties are, how they affect your body, what you can do to stay healthy, and to just keep you sort of enlightened and as far as your health is concerned. So today, like I said, we have Dr. Simpson, and it's just a real pleasure to have Dr. Simpson here. So, Dr. Simpson, why don't you start out? Welcome, and why don't you tell us a little bit about yourself?
Well, thank you very much for inviting me this morning. I am the Chief of Plastic Surgery at the Medical Center, also Chief of the Burn Center, and I've held the position in plastic surgery since 1989. Took over the Burn Center in 1981, and it's been a wonderful experience, certainly a service to the community. My education started at Syracuse University. I went to medical school at the University of Brussels in Belgium. Stayed on for 2 years of detailed internship there in Belgium, and returned to the United States doing my residency program both in general surgery and plastic surgery at the Nassau University Medical Center. It was then Nassau County Medical Center, and it's evolved and grown, and we've done quite a bit for our population and our public. My residency training was general surgery, plastic surgery, and additional training in hand surgery. And I joined a private practice in the community which had a tremendous commitment to the medical center. A little bit about history: plastic surgery at the Nassau University Medical Center, again, dating back to 1948, when it was a small place called Meadowbrook Hospital, was started by Leonard Rubin. Leonard Rubin was a excellent plastic surgeon, trained at Kings County in Brooklyn, and then got his experience in World War II. He was part of the 37th General Hospital, which moved up from North Africa, Italy, Germany, and he remained 6 years in there, getting awards for innovative things that he would do for the GIs who were terribly burned. When he returned to New York, they opened a practice in New York City, along with Dick Walden, who was, again, instrumental in forming our residency program. And in 1948, they moved out to Long Island. They were told by every one of their colleagues that they could never develop a practice on Long Island. It was impossible. They had to be in New York. Well, they proved them very wrong very quickly. They were instrumental in bringing plastic surgery to the medical center. They started the Burn Center in 1948, but in 1954, it was recognized nationally, and it was the fourth burn center in the United States to be recognized. So we have a long, glorious history, and we're very proud of that. My training in plastic and general surgery really kept me interested in critical care and burn care, and it's been a wonderful experience. We've been able to share that experience with the community, certainly taking care of thousands of patients with sometimes life-threatening injuries, but also instructing them, creating an educational process. And we've noticed that burn injuries have decreased probably about 50% in the last 10 to 15 years. And that's a national trend. So we're doing it right. We're teaching people, along with safety regulations in the workplace, airbags in cars. It's been a wonderful change in burn care. Medical Center has been our ally in providing us with everything we need to do state-of-the-art care for all of these patients, and we're very proud of that. On the plastic surgical side, we run a residency program, and we have since 1954. We will train two plastic surgeons a year. It's a 3-year program after they've completed their full general surgery training. So it's an in-depth program, it's a detailed program, and you can appreciate how well-trained plastic surgeons are when they finally finish their educational process. So we're very proud of what we do, and we're happy to give back.
Yeah, I mean, you definitely do bring a lot to the hospital. Yourself in particular, your service, the residents. It really is something that makes National University Medical Center very special. That burn center is a beautiful state-of-the-art facility that we have at the hospital that I know you were instrumental in helping support and build. It is held very closely by the fire service as one of the best burn centers in the nation. They support it. I know the fire services here in Nassau County claim it as their own. They like to say that it is their foundation, it's their burn center, and I know they give donations and golf outings and things to support the burn center. And although maybe nationwide the burns have decreased, I've never seen that burn center empty. There's always been the share of patients in there, whether a small child that was accidentally scalded by hot water, or a firefighter that was burned, or an auto mechanic that opens up a hot radiator before it cooled and was scalded with hot antifreeze. The hospital always has a lot of patients in that burn center, and I see your doctors there really taking time and diligence and compassion with these patients, because it is a really specialized field, because it's painful. It requires surgical debridement. They get horrible infections, and so it really requires the best of care. And partnering with yourself and the Long Island Plastic Surgical Group, I feel so honored to have you in that hospital in Nassau University Medical Center. And people don't realize that. I mean, the citizens in Nassau County, East Meadow, or throughout the county, that we do have such a premier service at that facility on Hempstead Turnpike. And not just for burns. I mean, burns, God forbid, that happens. We have the helicopters. We have 2 heliports. The Nassau Police helicopters will bring the patients in. The police ambulances or the volunteer ambulances will bring patients in. We have the hyperbaric chamber for smoke inhalation if that was a problem from a person that had a fire with carbon monoxide, or a person in a house now with the heating. Times are changing now. The weather is changing, so the boilers are going on. A lot of carbon monoxide emergencies. We have that in the hospital as well. So the fire service is integral with our burn center. But there's so much more to plastic surgery. I mean, you don't think about it often. And as an ER doctor, I'll have a young child with a facial laceration, and I'm pretty good at suturing, and I could probably do a good job at that. But if it was my child, I'll call you. I'll call the plastic surgeons, and you guys always respond. You'll answer the phone. You'll say, we have a fellow in house. We'll send them right down, and we're on the way. And I've had nothing but great, reports back regarding your service. So that's important in other ways other than just burns.
Absolutely. Well, thank you. And we take our commitment seriously. I tell my residents, again, who are at the postgraduate level, between 9 and 10 years, that means they finish medical school 10 years before, that they are the most trained residents and they have a responsibility towards professionalism. And so they're setting the trend for everybody else. They know what their responsibilities are. They know what they have to accomplish. The one thing about being a trauma center is, as you just explained, we're able to take care of anything at a moment's notice. We're prepared to take care of the small laceration of the face as much as we are a major crush injury in a work-related accident. And the good thing about my group is that we're all specialty trained in every different aspect of plastic surgery, general surgery, where it crosses over hand surgery. And so we're able to come to the hospital and take care of just about anybody without any problem. And that extends from replantation services, where we are reattaching limbs when needed, to the smallest problem, where the patient wants the best outcome. We're a detailed organization. We look at the fine details of things and try to get things to heal well.
So you mentioned hand surgery, and you would think hands, it's an important aspect, but to have a subspecialty just in hands, what is that, and how does that affect the training?
Well, hand surgery had always been a shared specialty, if you will, between orthopedics and plastic surgery. Now you see many more orthopedists who are doing hand surgery, but plastic surgeons have always been really attuned to fine detail. And there's nothing finer than the detail in a hand. Its motion, its ability to feel, its ability to do whatever the brain tells it to do. And restoring that involves taking care of the bony structure, the soft tissue, the nerves, the tendons. And it's really a passion. The people who do it are trained in hand surgery, but they have a great interest in not only repairing the damage, but seeing these patients through the rehabilitative phase until everything works as well as it can. You're working with children in the congenital mode, where you're trying to correct birth defects, again, along the lines of complete function of that hand. So there are still many plastic surgeons who enjoy it. Many of the training programs still offer a significant experience in hand surgery, but in our community it really takes additional training. It takes 6 to 12 months of concentrated training looking only at hand function from people who do it well, in order to get them to the point where they can say, yes, I can take care of every aspect of that hand. And that's what we pride ourselves on.
That's a lot of training. So not only do they go through the 5 years of a grueling surgical residency, which some say is the hardest of all residencies to undertake, then they go for an additional training in plastic surgery for 3 years, and then additional training either for hand or some other subspecialty within plastics.
Sure. Yeah, you're looking at 10 years of postgraduate training.
Yeah, people understand it. They think, oh, great, you graduate college and, we go to medical school. But no, the medical school is only the start of a training for a physician. You go through the 4 years of medical school, 4 years of college, then 4 years of medical school. It's already 8 years, and most of your friends are now going out getting jobs and making money. But no, now you have to go into a residency for 5 more years, and then a fellowship for 3. So, excuse me.
It's a long commitment, and you're seeing the marketplace change. You're seeing a very large number of doctors who were doing who were taking residencies in subspecialties stopping now. They're just not going for 8 and 10 years. It's something that continues to change, but there's no shortcut in plastic surgery. You may concentrate on one operation, or you may do the full variety of plastic surgical procedures, but there's no shortcut in the training. You've got to be polished in that, and it takes years of experience to do that.
Do you also, at your Long Island Plastic Surgical Group, also do cosmetic surgery? Sort of, breast enhancements, facial, different types of cosmetic things that they do. Do you do that as well?
We do. We do a fair amount of that. There we will take care of patients in our own operating rooms, which are accredited with certified anesthesiologists. So again, the emphasis is on safety and detail, and we treat those patients very well within our office complex. They're quite comfortable. The hospitals are a little bit too challenging for some of them who are coming into this at this point. So we're partly in our office, partly in the hospital. Again, we will do whatever it takes to get whatever that patient needs. Sometimes we will do cosmetic surgery in the hospital when the patients have pre-existing medical conditions that require strict oversight by cardiologists, by pulmonologists, and so we are very flexible. We'll go wherever we need to be sure that the patient is safe.
And the reason I bring that, because there's something that you do, and that's really amazing. And we have a mammography van at the hospital, and that mammography van goes out to communities and does mammograms. And it's really the state-of-the-art mammography equipment, tomosynthesis, to detect even the smallest of breast cancers. And that once the cancer is detected, hopefully at an early stage, it'll be able to be resected and cured. And a lot of times, the women and some men have to undergo mastectomies. And you have an amazing reconstructive breast team that have really done marvelous things with some of our patients. And I know that because we're constantly receiving awards and recognitions from patients regarding your team of physicians that work on these reconstructive type surgeries. And so that's like an amazing piece that you perform for the people here in Nassau County as well.
Well, thank you. I mean, I've heard from many breast surgeons that your equipment in detection is probably the best in the area. It's very sophisticated. It's picking up on minutia that is extremely important for early diagnosis. A number of our breast surgeons do a lot of breast reconstruction in combination with general surgeons, and they try to make the restoration complete at the time that the tumor is removed. And I think that's the best thing that you can do for the patient. The techniques in breast reconstruction range from a very simple implant, which is not usually done very often, but more into a very sophisticated reconstruction using microsurgery now to restore everything back to as near a normal condition as possible. And as you can imagine, it's tremendously rewarding to do that.
It is, because it's such a horrible disease and affects so many women, and so many women are, don't even know in the early stages. At Nassau University Medical Center, our radiology department, not only do we have the tomosynthesis, the machine in the van, but we also have it in the hospital as well. We have a second machine, and that breast clinic is available to anyone. All they have to call up, make an appointment, and come in and have a mammogram. And it's, we can't stress enough preventive medicine in medicine. I mean, I think that's one of the primary reasons or primary things as a physician that we can do is to have people look for problems and to get them early enough. And when we mean that, I don't just mean that in the sense of cancer, which is very, very important, and mammographies and prostate exams and other types of examinations to determine cancer in its early stages, pap smears and pap exams, but also for run-of-the-mill things like diabetes and hypertension and cardiovascular health, that weight, exercise, watch what you're eating, watch your cholesterol, take your medications that the doctor give you. So I think primary care in medicine is so important that we stop these diseases in their track, and we start giving medications and treatments for them to prevent them from having horrible sequelae like a stroke or a heart attack. And when it comes to breast exams and mammography, it's right at the top of the list, because if we get there early enough and we're able to get in there and remove that tumor and treat that person appropriately, we can actually save their lives, because too many of us have seen the devastating effects of cancers that were determined or found too late to do anything. So
no question, prevention is certainly the best way to go in early detection, and early restoration is giving us a good handle on this disease process. And I think we're continuing to make improvements all the time. Again, the field of microsurgery plays a great role here. And it is just an elegant way to do reconstruction. It's not only limited to the area of the breast, but in our trauma center, where we have sometimes devastating injuries, we're able to move tissue from one part of the body to another using the microscope to transplant everything. And so we're proud to tell you that we're taking care of our residents very well, and they're getting a full experience, and they're adding back into our armamentarium of plastic surgical care.
Yeah, and it's so important. I mean, physicians first, plastic surgeons second, or I don't know if that's the case with you guys. Plastic surgery is certainly taken over your entire lives, and that's what you're dedicated to. But, as physicians, we always have to make sure that our patients are healthy and to prevent them from getting sick. And so plastic surgery is so important in that regards. And to get someone back, even when they do have a heart attack or a stroke or any type of medical issue, the whole idea is to get them back to where they belong, get them back out into the workforce, get them back to school, get them back to taking care of their families. And reconstructive surgery and those types of things are so important, not only with we're talking about breast, but also trauma, facial injuries that occur, disfiguring injuries or amputations that you guys have sort of perfected with the field of microsurgery. Why don't you tell us about a little bit what microsurgery is and how do we do that in the hospital?
Well, microsurgery is simply the use of a microscope to allow you to do certain things, and it will go from repairing fine nerves that are very, very small and you're talking about 1 millimeter, sometimes a little bit bigger. With precision, you need to do that under the microscope where you're expanding the image anywhere from 25 to 40 times. It requires a certain amount of dexterity that is part of the learning process. Microsurgery really began in somebody's garage back in the 60s, where they began transplanting portions of an ear, which is really how it started, and found that they could get it to survive. And the veins and the arteries are put together, and sometimes the nerves, and you're getting a very, very sophisticated reconstruction that provides a complete replacement of whatever has been lost. Being a microsurgeon allows you, again, to take on any kind of aspect. The facial laceration may involve the facial nerve. The ability to do that with no delay is probably the most important change that we've experienced, because long gone are the days when doctors would say, okay, we'll just close the skin, they have an injury, we'll let them heal, and then we'll send them to the plastic surgeons. Those surgeons are well aware of what we need to do. They call us immediately, and before the patient leaves the operating room, those defects are restored and those repairs are made. This really enhances the recovery of the patient. They don't need to have multiple procedures. And so being able to do that, or to call on my partners if the need requires somebody with more sophistication, is exactly what our group has been able to provide. And I think it's extremely important for residency training to know that they can get anything supervised at any moment.
Amazing. So you're actually looking through a microscope at the skin. You're actually looking at the microscope to find the nerve endings, to suture nerve endings together, to reattach nerve endings and vessels together. That is really amazing. That's something you could only imagine in a science fiction movie, and here we're doing it right here on Hempstead Turnpike.
Absolutely, and almost every day.
Almost every day.
We recently had a fellow who had fallen from a height, tremendous facial injuries that were never really repaired, and left with a significant facial paralysis. We were able to take a muscle from his leg with the arteries, nerves, and the blood vessels and the nerves, and place it into the face, into the facial nerve, so that he is now able to animate his face using a completely new muscle structure, again, all done by microsurgery.
Amazing.
So it's a rewarding field.
Yep. And now I think robotics are getting involved in this as well. Is there any role for robotics in your field as well as in plastic surgery?
Well, it's hard. I watched the progress in many other fields. They're doing robotic surgery into deep cavities, so they don't have to gain access. For us, it is really in the area that you're seeing. A number of plastic surgeons have been doing some very sophisticated robotic surgery in areas that don't require second incisions to get to them. So the patients do better. It's still in its early trials, at least for plastic surgery.
Yeah, I mean, we've seen it being used for some gynecological surgeries and some other issues, but yeah, plastic surgeries, you would think it's such minute movements and such small movements to get inside a nerve and a vessel to suture them together. That really takes a steady hand and lots of training for that. And it's really, we must stand at awe at the training and the dedication of someone that would actually do that, and they dedicate their lives to that.
Well,
It's
thank you.
amazing.
It's become a passion for most of us. We enjoy it. We enjoy seeing the patients better off, and we're happy to provide that service.
And I see it every day at the hospital. Here you are at the National University Medical Center with your team of really highly skilled physicians, and here you are taking care of the public safety net hospital. You're taking care of patients that really are, lower socioeconomic classes, people who have no types of insurance. You were recently awarded by a group called Rotacare, which is in Uniondale, that basically has basically undocumented patients that have no insurance, no way to pay, and that the Long Island Plastic Surgical Groups under your leadership have extended yourself into that community to do amazing things for that patient population that would normally not get that type of level of care.
Well, I think that's very important for us to do that. When I was very early into my practice, my senior partner, Dick Walden, told me that it's about giving back to the community. and that each of us had to do something that showed that we were able to take our specialty and our expertise and provide it to the people who needed it, oftentimes the people who need it the most. And so our mission in our group is that this is what we do provide, not only for people, regardless of their ability to pay for these things, but the people in other countries. We've recently signed an agreement with an organization called Resurge, which is dedicated to going to areas internationally, to underserved areas for sophisticated surgeries, and helping the patients and also teaching the local physicians how you can take on some of these different problems. I'm headed to India in the spring to teach a hand surgeon about burns. And he has a tremendous population of burned hands that are not functioning well, and it's an honor for me to be invited to go and teach these people what they can do, give them all of our sophisticated techniques, and hopefully they'll benefit their population.
Right? Because you need your hands to survive, and especially in the poor countries that depend on manual labor and farming, and if they can't use their hands to farm and to build things, they're going to starve. They're not going to make a living. And in these areas, such as India and some of these foreign countries that don't have the resources that we have here in America, that a lot of us take for granted, that really makes a difference between survival.
Oh, you're absolutely right.
People.
It's a humbling experience, and to know that you can give back to the community, that was always very important for me.
We had that here at Nassau University Medical Center, that feeling of giving, that feeling of going above and beyond to help patients. I mean, I remember after the earthquake in Haiti, we immediately amassed a full team to fly down to Haiti and set up a mobile emergency room with the emergency room doctors and surgeons, and to just take care of those patients as well. And so we have that in us at the Nassau University Medical Center
I think that's
do
part
that.
of being there.
Yeah.
That is part of the mission, and I think at least my physicians feel that way. They feel that we have an obligation to do what we need to do, and there's really no regard to who can afford services, who cannot. That all falls into the residency training program, and we're very happy to be a participant.
Yeah. And as a level 1 trauma center, to know as an ER doctor, again, knowing that you were there to respond within minutes to the emergency department to help us in all these types of instances, it really was great to know that we had you there, as well as other specialties in that hospital, whether it's thoracic surgeons or gastroenterology or orthopedic surgeons. People don't realize what is available in that hospital. I mean, the amount of services, the residencies. I mean, ophthalmology, one of the most sought after specialties for eye problems, are in that hospital. Plastic surgery, burn,
We have everything.
Everything, and orthopedics, and we have an unbelievable orthopedic group in the hospital with Dr. Rotolo and his team. And you think you go into like one of these really swanky Manhattan hospitals to get this level of care, but here we are. We just recently hired a neurosurgeon, Harvard trained, Columbia residency, Columbia fellowship, and then went to the Swiss Institute for Spine. And she is here now at Nassau University Medical Center full time to treat. And in the first few months that she's been here, she's diagnosed over 13 and treated over 13 brain tumors, and she has such a way about her and such a confidence when she operates that it makes you feel so good, and you know that patient's going to have a great outcome. So it's an amazing hospital, has amazing physicians such as yourself that are dedicated. I mean, the word dedication, really, you should have your picture underneath the word dedication, Dr. Simpson. I mean, it's just amazing.
It's our pleasure.
The hours and how far above and beyond your team goes. And as the CEO and president of the hospital, who's been involved in many hospitals in the past in all different senior level positions, I'm so proud to be here myself, and so proud to see or to be part of this team to work, with doctors such as yourself. So I'll just give you the last final goodbye, and then I'll close up the show. So it's all yours, Dr. Simpson.
Well, thank you very much. And again, it's our pleasure. I mean, we feel we're part of something bigger. We enjoy providing the care and teaching the residents. And our burn center, again, is really run by people who are passionate. It's a multidisciplinary approach, and we're very happy to be able to do that. And I want to thank you for the help that you've provided for us, because Without you there, we just can't get everything done. Thank you.
Again, Dr. Simpson, really amazing, and thank you very much for being here, for all you do. I'm Dr. Victor Politi. I'm the President and CEO of Nassau University Medical Center, here with Health Talk, and we'll see you again in 2 weeks for another show. Hopefully you're picking up some information and you're learning something about the Nassau University Medical Center and about healthcare. And I really appreciate you listening, and I want you all to have a great day. Okay, bye.